Blood vessels made in the lab, and grown in lambs, could offer hope for children with congenital heart defects in desperate need of grafts, a study reports. Researchers in the U.S. have produced bioengineered sections of artificial artery, which can be used in heart surgery, and are able to remodel and grow like normal vessels after the procedure. The grafts overcome one of the most critical aspects of surgery, where the host's body rejects the tissue, with researchers reporting the potential to avoid the need for repeat surgery. What's more, the team says, its off-the-shelf tissue grafts can be stored until they are needed, without the need to use a patient's own cells. This might be the first time we have an off-the-shelf material that doctors can implant in a patient, and it can grow in the body, said Professor Robert Tranquillo, a researcher at the University of Minnesota, who led the study. In the future, this could potentially mean one surgery instead of 5 or more surgeries that some children with heart defects have before adulthood, he added. To generate the sections of artificial artery, a team at the University of Minnesota used skin cells taken from sheep and grew them in a specialized tube system, which fed the cells with nutrients, prompting them to develop into connective tissue. Following weeks of growth, the sheep cells were then washed away, leaving just the structure, a rubbery scaffold of connective tissue. These resulting tubes were 16 millimeters in diameter, and slightly thicker than a lamb's artery, but with a similar strength and with the same biochemical properties. Lambs received the grafts after having a small section of their pulmonary artery removed, and replaced with the lab-grown vessels. After almost a year, the team showed that the grafts had been completely incorporated into the animal's circulatory systems, with their own cells growing over the grafts and fusing with the structural support. Animals which received the grafts were reportedly healthy, had typical blood flow and gained weight as normal. Grafts which were removed after an extended period of growth showed strength and thickness of typical sections of pulmonary artery, with smooth muscle, endothelium, blood vessel lining, and other features. The findings are published in Nature Communications. The authors explain, tissue engineering has the potential to overcome the limitations of existing treatments for congenital cardiovascular defects. They add that while the proof of concept is a key step, further trials are needed to see if the procedure is safe and effective in humans. We saw growth and none of the bad things happened, said Professor Tranquillo. The results are very encouraging. Commenting on the findings, Professor Peter Weisberg, medical director at the British Heart Foundation, said, "This exciting research indicates that it may be possible to create blood vessels in the laboratory that will grow as the heart grows. This could reduce the need for these operations, and potentially improve the quality of life for children with congenital heart disease."